Hello, Ethan. My name is Carlo. I'm going to be your nurse today.
Hello, how are you?
Good. How are you feeling today?
I'm feeling fine.
Okay, what brings you in?
I'm here for a regular checkup.
Okay, no problem. We're going to do a full head to toe assessment. Do you have any pain today?
Nothing.
All right, I'm just going to don my gloves and do a little assessment, okay?
Okay.
First things up, we're going to do your vital signs. We're going to do your blood pressure on the left arm, and we're also going to take your temperature. Okay. All right, just hold your arm like this as it takes your pressure. While it's doing that, I'm going to take your temperature using your forehead, okay? Okay, the patient has a temperature of 100.2. I'm going to use this pen light. It's going to check your pupillary reactions. Okay. Both pupils are equally reactive to light and accommodating. The blood pressure just came back. It is 149 systolic with a 90 diastolic and a pulse of 100. Take this off. Okay, first thing I'm going to do is inspect your head. I'm going to check your hair for any lice, any bed bugs, and any hair deformations. The skull seems to be intact and well shaped, symmetric on both sides. I'm palpating for posterior cervical lymph nodes. Do you feel any pain or tenderness here?
No.
Okay. No palpated cervical lymph nodes on the back. I'm going to check both ears for tenderness and for expansion. Any pain or tenderness?
No.
All right. The next thing I'm going to do is palpate for anterior cervical lymph nodes. Just tell me if there's any pain. Any pain?
No.
Perfect. All right. Upon inspection of the skin, there seems to be no discolorations around the neck or on the head. There is a pimple on the right side of the eye, but nothing else of note. So next, I'm going to test your lungs. So I'm going to have you position yourself like this. And then I'm going to auscultate the back of your lungs. You're going to breathe deeply every time I move the stethoscope, okay?
Okay.
Pull up the shirt. Reveal some acne, but otherwise no deformations. Take a deep breath. Okay. The breath sounds are clear bilaterally on the posterior lungs. Next, I'm going to auscultate the anterior chest. I'm going to pull your shirt up. The chest is symmetric. Take a deep breath. Next thing I'm gonna do is auscultate your heart, okay? Your lungs were clear on the anterior side, bilaterally. Just breathe normally. Testing the tricuspid. Testing Erb's point. The mitral. And testing the apex. All right, thank you. The heart sounds auscultated revealed no gallops, murmurs, and an audible S1 and S2 heart sounds. Both lungs were clear bilaterally and to posterior and anterior sides. Next, I'm going to check your pulses on your arms. That would be the radial and the brachial pulses. Okay? Testing the radial pulse on the left. Okay, the 2+ pulse. Two plus on the left brachialis. Now testing the right arm. Two plus on the radial on the right. Two plus on the right brachium. All right, so your pulses were good on both arms. The next thing we're going to do is have you lie down flat and test your abdomen. Okay, can you please lie down flat for me? Okay, I'm going to pull up your shirt and inspect the abdomen. The abdomen on inspection seems to be clear and rounded. First thing I'm going to do is auscultate for the abdominal aorta. No thrill or bruit was auscultated on the aorta. Next, I'm going to auscultate for bowel sounds. Okay. All quadrants of the bowel were auscultated and they revealed no more active bowel sounds. Next I'm going to do is palpate the abdomen. I'm going to first do some light palpation. Tell me if you feel any pain, okay? Any pain?
No.
Okay, no pain noted, no tenderness on light palpation. Next, I'm going to do some deep palpation. Any pain?
No.
Okay. Next, I'm going to assess for palpation of your kidneys and your liver. First thing I'm going to do is assess for your kidney and your spleen. I'm going to hold my hand here and push on the other side. What I need you to do is to breathe in and out, okay? Any pain?
No.
Okay, good. The left kidney and the spleen are not palpable. Next, I'm going to assess for the liver. I'm going to put my hand here on the right costal margin and then push on this side. Can you just breathe in and out for me? Okay. Did you feel any pain?
No.
Good. All right, the liver was also not palpable. Next, I'm going to have you sit back up. Thank you. So first, I'm going to test your muscle reflexes and your muscle coordination. So I'm going to have you stand up for me. Okay. Can you put your feet together and just close your eyes for me? Okay. Can you just walk around for a second? Perfect. You can come back and open your eyes. Okay. No problem with coordination. Can you please tilt your head up and down? Okay. Can you turn your head left and right? Any pain?
No.
Okay. I'm going to push against your shoulders. Try to shrug as hard as you can. Any pain?
No.
Okay. Good resistance to movement. Next, can you please hold your arms up? Okay. Can you alternate between having them face up and face down?
Yep.
Perfect. Any pain when you do that? Any problems?
No.
Okay. Patient's able to perform alternating movements. Now, can you please take your index finger and put it on your nose? Okay. And do it with the other hand. Okay. Now, the next part is, can you take the heel of your right foot and run it down against the shin of your left leg? Perfect. Can you do it with the left heel?
Mm-hmm.
Good. Okay. Any pain when you did that?
No.
Okay. Before you go, I'm just going to auscultate your carotid pulse. The carotid pulses are a 2+ with no bruit or thrill palpated on either one. All right, thank you. Can you please lie back down? Okay. The last part is going to test the pulses on the feet and for edema. I'm going to pull up the sleeve. Okay. I'm going to first test for pulses on the foot. Okay, 2+ on the left dorsalis pedis, and now the right foot. Two plus on the right dorsalis pedis. I'm testing the legs for any edema, any swelling. Does it hurt?
No.
Okay, there's no edema noted on either leg. Skin turgor is also good on the leg. Okay, next thing I'm going to do is test your Babinski reflex. I'm going to run this sharp object down your foot to see if anything happens. It showed a negative Babinski reflex. Okay, and then we're going to test your hip rotation. Can you please bend your knees for me? Okay, bend them back. Can you please rotate your legs in and out? Okay, good internal and external rotation. Can you spread your legs apart? Okay, does anything hurt?
No.
Okay, you can, and now put them back together. Okay, hip range of motion is intact. The last thing we're going to do is test some of your nerves. Can you just please sit back up? Perfect. Okay, so first thing I'm going to do is test your olfactory nerve. So can you please tell me what this is? What do you smell?
It smells like vanilla.
Oh, okay, you're right. Okay, we're going to use this pen. You're going to follow it with your eyes without moving your head.
Yeah.
This is going to test your cranial nerves 2, 3, 4, and 6. Okay. So follow this. Okay. Next thing we're going to do is we're going to test your shrug. So we're going to meet with resistance again, just a shrug. Perfect. Okay, can you please make a smile for me? This is testing cranial nerve 5 and 7. Frown. Okay, and then puff your cheeks. Okay, very good. We're going to test your gag reflex, and we're going to do that by using this tongue depressor. This is going to be your tongue depressor. So open your mouth and stick your tongue out and say ah. Ah. Keep doing it. Ah. Gag reflex is positive. Thank you. Okay, and now stick your tongue back out and wiggle it side to side. And that tests cranial nerve 12, the hypoglossal. Okay. So I'm also, the last thing I'm going to do is, because you had a fever, I'm going to inspect your nostrils, okay? So using, this is my my flashlight. Okay. Testing the conjunctiva. Okay. So upon examination, it reveals that some of your your left nostril is inflamed, but your conjunctiva are not. So you might have had some sort of cold or some sort of infection, because you do have a fever. So because of that, we will have you talk to the doctor, maybe get some medicine for the cold, or maybe some antibiotics, and then you're going to take some medicine to reduce the fever. Okay? Something like Tylenol.
Yep.
All right. Do you have any questions for me?
No, that's it.
All right. Well, thank you for coming. We'll see you in a couple weeks.
Okay, sounds good. Thank you.